Hello, my name is Bo Singletary, President of Laurel Insurance Partners. Thank you very much for attending this online webinar for Medicare Explained. And just to tell you a little bit about us, we are what's known as a field marketing organization, meaning that we are 100% independent, meaning that we can offer you the best deal or look at all carriers when it comes for your Medicare needs. We do not have to pledge allegiance to one company in order to build renewals. We focus strictly on client and broker retention. Now, before we get started here, I'd love to show this little video clip. Alright, now you can see why I like that video so much. Alright, so let's kick this thing off. What is Medicare? Medicare is a health insurance program for people 65 years of age and older. And Medicare was created by Congress in 1965. It is an insurance program for those people that are 65 and older, people under 65 with disabilities, or people with any age with end-stage renal disease. In other words, permanent kidney failure requiring dialysis or kidney transplant. President Lyndon B. Johnson signed Medicare and Medicaid programs into law on July 30th of 1965. Medicaid became effective January 1st of 66, while Medicare became effective July 1st of 66. Medicare is the nation's largest health insurance program, currently covering about 63 million Americans today. So let's just discuss the Medicare coverage basics. First of all, you have your Part A, which is very simple. Your hospital coverage. As long as you've paid in 10 years or more into Social Security eligible employment, you do not pay for this. Part B, you do pay a premium for. This is your medical, or as I like to call it, your doctor coverage. This pays a portion: doctor services and outpatient care, preventative services, diagnostic testing, some therapies, and durable medical equipment. And then kind of lateral to Medicare Part A and B is what's known as a Part C plan or Medicare Advantage. This takes the place of original Medicare while you continue to pay your Part B premium. Claims are paid through private insurance companies. So there's in-network and out-of-network providers, and it's not as broad of a coverage or network as Medicare and the Medicare supplement together. And then finally, what goes along with Medicare A and B are your prescription drug plans. Those are individual drug plans sold by private health insurers, and it's mandated by the federal government that came about during the Bush administration. So, with Medicare, you have two directions you can go. You can go to your left, you see you can keep your Part A and Part B, and then from there you can purchase a Medicare supplement or a standalone drug plan, or just have Medicare A and B. Part C is the Medicare Advantage plan I just mentioned, where you still continue to pay your Part B premium while claims are paid for by private health insurers. So, from there, what you need to know is applying for Medicare, you apply 3 months before you're age 65. You do not have to be retired. Best way to do it is to contact the Social Security Administration, or for really easy access, just go to Medicare.gov. It's not as convoluted as you might think. It takes but 5 minutes to sign up, and it's pretty straightforward. So the initial election period is what's 3 months prior to your 65th birthday, the month you turn 65, and 3 months following your 65th birthday. So the IEP, in other words, is a total of 7 months. Last note on this slide is enrollment in Part A and B is automatic if you're already receiving Social Security or railroad retirement benefits. If you're not, you will need to log on to the Medicare site in order to enroll in Medicare Part B. All right, with original Medicare, you go to any doctor, specialist, hospital, or other healthcare provider that accepts accepts Medicare. While most people don't pay a Part A premium, they are responsible for the Part A deductible. Herein lies where a supplement comes in, and we'll go over those costs in a little while. In Part B, in 2017, the annual deductible was $183. Now it is $185. After that is met, Medicare pays 80%, and then leaving the remaining 20% on you to pay as the insured. Once again, this is where supplements are going to come in, and I'll discuss that in a little bit. So Medicare Part A, most people receive Part A premium for free, which I've already stressed. Basically, you're going to have deductibles when you go to the hospital, north of $1,300 in order for them Medicare to pay the first 60 days. And on skilled nursing care, for example, you get the first 20 days covered at 100%. After that, the deductible from days 21 through 100 is $164.50 a day. Okay, the Part B premium was $134 in 2017. Now it is $138. Oh, excuse me, $135. And again, the Part B, you have 7 months, 3 months prior to your 65th, the month that you turn 65th, and 3 months after to enroll in Part B without penalty. So let's discuss the enrollment periods. Marie turns 65 on June 25th. She will have group coverage from her employer until she stops working on December 31st, 2017. So, her Part B enrollment periods are the initial election period, which starts 3 months prior to her 65th, so that's going to put it starting in March 1st, the month that she turns 65, so the month of June, and then 3 months following that. The special election period starts she has the same amount, a little bit more time actually for a special election period, because how that works is the first month that she's planning on retiring, it goes from there. And then after that is 8 months after beginning in the next month. So it'll run from December 1st all the way until August 1. So paying the Part B premium, very simply, if you're already taking Social Security, it comes right out of that. And if you're not taking Social Security, it's billed every 3 months and you pay it using the Medicare Easy Pay system. Now, for not enrolling in Part B, you are charged a penalty. You're charged 10% for each 12-month period eligible but not enrolled. So, that's it. You will pay that penalty for as long as you are on Medicare. There are some exceptions to if you've had good coverage or if you've had qualifying coverage through an employer. You do not have to take Part B, nor will you be charged a penalty when you do sign up for Part B. So Medicare Advantage plans, which we've already touched on, but basically there's 3 types. You got a health maintenance organization, an HMO plan, you got a preferred provider organization, which is your PPO, and finally you got private fee for service, and then special needs plans, which are designed for people on disability. Eligibility for having these particular Medicare Advantage plans. You must live in the plan service area. You are entitled to Part A and enrolled in Part B. You must continue to pay your premium. However, none of the claims are being paid for by Medicare anymore. They're all being paid for by the private health insurance company. The thing is this is a zero to a very low-cost plan. Now, I do want to tell you, these plans in particular, you are limited. You are in network really for the county in which you live, whereas Medicare and a Medicare supplement go everywhere. Now, with Medicare Advantage plans, you do have to use providers in your plan's network. You must still pay your Part B premium, but you also get some added benefits such as vision, hearing, dental services, and prescription drug coverage. Now, Medicare supplement, which I think works great, and especially in rural communities, because Medicare Advantage plans have very strong networks in large metropolitan areas. As you get out into the countrysides, the networks tighten and the coverage is not as broad. They are sold by private health insurance companies. They cover the gaps in original Medicare. In other words, they're going to pay the deductibles. They're going to pay the co-insurance and the co-payments. Everything that Medicare bills for, they pay. So all you're left with is a monthly premium. There is no need, nor can you have a Medicare Advantage alongside of a Medicare Advantage or alongside of a Medicare supplement. So people who buy a Medigap or a Medicare supplement policy within 6 months of enrolling in Part B, you must be age 65 or older. You also can get it if they lose certain kinds of health coverage through no fault of their own, or if they decide to leave a Medicare Advantage plan under certain circumstances. They can also have a guaranteed right to health coverage. You do pay a monthly premium, but you can go to any doctor or specialist that accepts Medicare. How Medigap plans work, very simply. With a supplement, you do not have any additional out-of-pocket expenses outside of the premium for that particular supplement for your health care. I'm not talking prescription drug coverage, just your hospital and doctor coverage. Part B, there's two plans that I like to touch on. Plan F, which is going away in 2020, pays the Medicare annual deductible of $183, which is actually $185 now. The Plan G does not. Everything else is identical. If a doctor does not accept assignment, they can charge no more than 15% than the assigned amount set by Medicare. Both Plan F and G pay those excess charges. Most other plans do not. Now, prescription drug coverage. Coverage began in January 1st of 2006. Is available to all people on Medicare. It is provided by private health insurance companies. Also it is incorporated automatically in Medicare Advantage plans. And oftentimes, some employers and unions offer prescription drug coverage for Medicare recipients as well. So, the initial enrollment period, we won't necessarily touch base on, nor will we on the special enrollment period. If you want more information on that, just back up a few slides and look at it. Okay, now, the annual coordinated election period, often referred to on the TV as the open enrollment period. The annual coordinated election period runs from October 5th to October 15th through December 7th. And that's when you can make changes to your prescription drug coverage or enroll in new prescription drug coverage if you are already on Medicare for the following calendar year.